the concept of quality in the medical field. Quality in the practices refers to the systematic efforts to ensure that healthcare services meet certain standards and deliver optimal outcomes for patients. The Institute of Medicine, IOM, defines quality as the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. Core dimensions of quality in healthcare. It involves multiple dimensions, each contributing to overall healthcare excellence: patient safety, effectiveness, patient-centeredness, timeliness, efficiency, and equity. Patient safety, through implementing protocols to minimize risks and prevent errors in care delivery. This includes measures like infection control, e.g. hand washing, medication safety, and the use of checklists to ensure safe surgical practices, fall prevention measures. Monitoring and addressing patient safety incidents through error reporting. This encourages a culture where staff can report errors or near misses without fear of punishment, and using this information to improve healthcare medical practices and to prevent future occurrences. Effectiveness. Providing services to achieve the desired health outcomes by using the best available evidence-based practices and clinical guidelines that are proven to be effective for specific conditions. Regularly tracking and evaluating the outcomes to ensure that care meets the intended goals. Patient-centered care, delivering care that is respectful of and responsive to individual patient preferences, needs, and values. Providing clear, understandable information and involving patients in their care planning and decision-making processes. Timeliness, reducing waiting times and harmful delays in care, which can improve outcomes and patient satisfaction. Streamlining processes to minimize waiting times for appointments, treatments, and procedures. Ensuring that care is provided as quickly as possible to address acute issues and prevent complications and improve health outcomes. Efficiency. Optimizing the use of resources, including time, staff, and equipment, to deliver care without waste, while maintaining quality to maximize value. Streamlining processes to improve operational efficiency. Equity involves providing care that does not vary in quality because of personal characteristics such as gender, ethnicity, geographic location, and socioeconomic status. This involves identifying and addressing disparities in care and ensuring that all patients have access to high-quality care. Principles for achieving quality in healthcare. Accessibility, ensuring that healthcare services are readily available and easy to access for all patients that can receive care when needed. This can be achieved by improving physical access to healthcare facilities and availability of services across different geographic areas. Providing information and support to help patients navigate the healthcare system. Continuous improvement. The concept of quality in healthcare is dynamic and continuously evolving, reflecting new technologies, clinical practices, and patient expectations, with regularly monitoring and evaluating healthcare processes and outcomes to identify areas for improvement. This often involves quality assurance programs, audits, and the implementation of best practices. Incorporating these elements into healthcare practices helps to create a system that is reliable, effective, and capable of meeting the needs of all patients. Collecting and acting on feedback from patients and staff to refine practices and address areas of concern. Patient outcomes, evaluating the results of healthcare interventions in terms of patient health and well-being. Monitoring the results of healthcare interventions such as recovery rates, complication and mortality rates, and patient satisfaction. Using outcome data to improve care practices and patient management. Clinical competence. Ensuring healthcare providers have up-to-date training and credentials to deliver competent care. Encouraging ongoing education and professional development to keep up with advancements in medical knowledge and technology. Verifying that providers have the necessary qualifications and skills to deliver high-quality care. Ensuring that healthcare providers have the necessary skills, knowledge, and credentials to deliver high-quality care. Ensuring certification and licensure are up to date. conducting regular performance evaluations and competency assessments. Data and technology utilizing electronic health records to enhance coordination of care, improve accuracy, and streamline information sharing. Availability of data and data analysis to identify trends, monitor performance, and make informed decisions about care practices. Patient engagement, providing patients with clear information about their treatment options and involving them in the decision-making process. Educating patients about their conditions and treatment options.